Ko matatua te waka, ko putuaki te maunga, ko whakatane te awa, ko Ngā Te Awa, ko te whana apanui te iwi, ko Martin Chadwick aho. Kia ora and welcome. My name is Martin Chadwick and I'm the Chief Allied Health Professions Officer here at the Ministry of Health. This is a really special day for me and a special opportunity to be talking to you because it's where we are putting forward the Allied Health Business Plan within the Ministry of Health. And so this has taken several years of being in the Ministry to get a sense of how can Allied Health best contribute to the concept of pai ora, which is living longer and living better lives for Māori and for all other peoples. And Allied Health has got a crucial part to play with that. And so going through this process of putting this business plan together has allowed us to really articulate some of the key things that are key principles for us and hopefully are key principles for you as we look towards achieving that sense of pai ora for our peoples. One of the first things has been the opportunity to, within this document, to really articulate what is Allied Health. Because it is a social construct. Medicine is medicine, nursing is nursing. Allied health is a social construct, and so I've used it to really define it that it is an inclusive term, that it is 43 plus professions that are included within the term allied health. And very explicitly, I've used it as an opportunity to say that you have the therapies and you have scientific and technical, but when I'm using the term allied health, I'm using it as an inclusive term. It is inclusive of all of the professions that are not necessarily or aren't identified as medicine, as nursing. So going forward, when you hear me say allied health, please understand as I'm using it in the fullness of that context. The second thing we've had the opportunity to do within this business plan is to really talk through our commitments to Te Tiriti o Waitangi. And understanding that the principles that have come out of the Y2575 have really clarified what we need to be doing to really meet those obligations around tino rangatiratanga, that sense of self-determination and how we can be assisting with that. Within that concept of equity, that there is so much that we need to do to make sure that we are looking at equitable outcomes, but then what that requires as far as equitable input to get those outcomes. It also looks at the component of active protection, that if we look at health outcomes for Māori, that there is a need to have an active protection of these peoples, that we need to be doing more in this space, which requires options, which is another component, and partnership. It's requiring us to work with Māori to get the better outcomes for Māori. And so it's given us that opportunity to really say that here are the principles and here are how we're going to discharge that better within our grouping. Specifically within the office of the Chief Allied Health Profession Office, it's allowed us to have our own vision statement and to look at what are the key things that we want to try to focus on. And specifically trying to focus on how we're going to improve health outcomes for priority populations in the community, how we want to enhance the value of allied health services and preventing acute care in the primary health care sector, how we want to provide high quality services that meet the needs of consumers and their whānau, how we can better support allied health services to use available technologies and digital therapies to enhance their practices, and how to support the allied health workplace to develop services based on contemporary and accurate data. So those are the key things that we're trying to focus on. And within that, it's also allowed us to actually put into writing some of the language that I hope we can use more and more. And specifically to look at what is intra, inter, multi and transdisciplinary practice. To really talk about how intradisciplinary practice is when you work within a professional group. Interdisciplinary practice is when there is a formal handover or referral between professional groups. Multidisciplinary is where you have groups that will work together but may still be hierarchical. Transdisciplinary, I would put forward, is where we need to try to work towards as much as possible, which is when professions work together and where there is a sense of teamwork as opposed to hierarchy and how we seek to deliver the best services to the people we're here to serve. And I'd argue in transdisciplinary practice is that the person that we're working with is a part of that team. It also is an opportunity to talk about models of care. What is the definition of model care? To look about its patient centricity, to look at how we use our skill sets to best affect how we are looking at efficiency, but also looking at how services are best delivered. And that is then boiled down to the nitty-gritty of, so what are the things that we are trying to do? And specifically to go to some of the key outcomes that we're looking for, that when we look at our at-risk workforce, coming into this office is that there has been many issues around workforces sustainability that haven't necessarily had a home in the past, but they have a home now. And so it's been that ability to look at where are the issues around workforces that may be fragile, for want of a better descriptor, and how do we ensure that we can get a pipeline that is going to be sustainable, not just now, but going into the future to meet as we grow as a population. It's identifying that there are areas of clinical risk, and we can't lose sight of the clinical risk, and so to make sure that we discharge our responsibilities as kaitiaki of the health system to look at observing, understanding where the clinical risk is, and then helping to put plans in place around that. And it's providing leadership, knowing that we as a collective are somewhere between a third to a half of the total workforce. And so providing that leadership, not just within this role, but out in the broader sector. It's also taken on the responsibility of, we now live in a COVID world. And so how do we look at how we provide services, not just at level 1 that we're enjoying when I was taking this video, but if we were to go into level 2, 3 and 4. And how do we always seek to try to find a right balance between protection, but then also understanding that there is wellness, and when people can't access services, that wellness tends to suffer. So how do we find that right balance between protection and wellness? And it's also the concept of developing the economic utility for allied health, because in healthcare there is always going to be competition for the health dollar. So how can we be better as a collective in demonstrating the value of allied health, that there is greater utility if the health dollar was to be invested in allied health? Then it's around equity within the allied health workforce. For almost all of the allied health workforces, we do not represent the population of Aotearoa New Zealand. So there is a real need to start to have a longer term horizon on how we start to build people going into the training programs, how we make the training programs more supportive of Māori, Pacifica and all other peoples. But then also as they come into the workplace, is that we say that there is such a thing as institutional racism that we need to be wary of, and ensure that that does not inhibit people going into the workplace and being able to flourish as a professional. It's also acknowledging that we need to then connect with the sector more broadly, to see that the Ministry of Health is part of the sector. We're not separate from the sector. And so how can I, in my role, my office, how we can be linking more so that there is an understanding of what happens here and how it impacts on what you do in your everyday. And so that's what we're trying to achieve with this business plan. We're trying to wrap all of that up. We're trying to give it to you in a form which hopefully is somewhat digestible, but more than anything, it is to start a conversation, because this time round we have pretty much written it ourselves. But I think it's an understanding that next time around we need to go back out and we need to do it with people. We need to do with it you in the sector, and to make sure that it is a business plan which is really owned by the sector. But for now, it becomes just that, a starter for a conversation. So I look forward to coming out, meeting with you, discussing it, and seeing what else we need to be taken into consideration for the future. Go well, and I look forward to seeing you soon. Kia ora.